Penetrating keratoplasty has been performed for over 100 years, so we have a lot of information and long-term follow-up. DSEC is much newer. The first case was reported in 2003, and so we still don't have as much information about how long-term DSEC will compare with penetrating keratoplasty. To help answer this question, we've been evaluating our DSEC graft survival and cell loss over 10 years. And then we are comparing the findings with penetrating keratoplasty, and we're using as our baseline the multi-center cornea donor study, where they had similar indications for grafting, Fuchs dystrophy and pseudophakic or aphakic corneal edema. We performed a retrospective single-center longitudinal study where we reviewed 1,005 consecutive DSEC cases. And we did not include cases to treat failed penetrating keratoplasty because we wanted to match the indications from the cornea donor study. 84% of the patients were treated for Fuchs dystrophy and 15% for pseudophakic or aphakic corneal edema. Out of the pseudophakic and aphakic corneal edema group, 30% had prior glaucoma surgery. About 2/3 were female, and most of the patients were white. The median age was 69 years old. We are still collecting 10-year follow-up on these patients, but our preliminary results show that the 10-year graft survival for DSEC is similar to the 10-year graft survival for penetrating keratoplasty, both for Fuchs dystrophy and for pseudophakic or aphakic corneal edema. We did find that prior glaucoma surgery is the most significant risk factor for graft failure. We have previously shown this in a 5-year follow-up analysis, and now, it shows up again at 10 years. So the patients without prior glaucoma surgery have a 15% failure rate over 10 years, but if patients have a prior trabeculectomy, the failure rate was 48%, and if they had a prior aqueous shunt, it was 71%. Again, this does not include patients that had a prior penetrating keratoplasty. Now, we also tracked endothelial cell density over time, because we know that even in normal eyes, we are losing endothelial cell density over time, and that occurs at a faster rate after transplantation. We found, so these bars on the graph are each the interquartile range. The horizontal line is the median, and the triangle is the mean data, and we're showing preoperatively 6 months and then annually out to 10 years. The lines that are graphed there are 4 statistical models that we applied to the data. All of the models agreed in that the cell density declined at essentially a linear rate of about 110 cells per millimeter squared per year between 6 months and 10 years after DSEC. So in this series, the median cell loss was 32% at 6 months and then 71% at 10 years. We found that overall that graft failure rate was pretty low. We didn't actually have that many patients that had prior glaucoma surgery, so mainly the cohort is determined mainly by the patients that did not have prior glaucoma surgery. And so selective dropout from graft failure did not have a significant effect on this endothelial cell density analysis. The bars here show, the clear bars show all eyes, and then the gray bars show the eyes that had clear grafts at 7 years. So you can see it's essentially the same whether we look at just surviving grafts or if we look at all the grafts. We did find that cell loss did occur a lot faster in the eyes that had prior glaucoma surgery. Those eyes are shown in the black bars. So when you look from 6 months to 1 year, 2 years, 3 years, and 4 years, you can see how much faster the endothelial cell density is dropping in these eyes. Now at 5 years, the endothelial cell density looks okay, but that's because we only had 3 grafts with endothelial cell densities at 5 years. Most of those grafts with prior glaucoma surgery had already failed. Now, we found that the 10-year endothelial cell density was not significantly correlated with the donor endothelial cell density. So this may be surprising to you, but within the range of cell densities that we accepted for our donors, there was not a significant effect over time. And this suggests that you can be reasonably flexible with your requested donor endothelial cell density. We found that the 10-year endothelial cell density was significantly correlated with the 6-month endothelial cell density. And so that means that we have to be really careful to try to minimize perioperative cell loss, because where the person is at 6 months has a strong correlation with then what happens over time. So how did DISSEC compare with penetrating keratoplasty? The clear bars are DISSEC, and the gray bars are penetrating keratoplasty in the upper panel. And then in the lower panel, we're showing the statistical models for the two procedures. So the DISSEC is the solid line that has a linear cell loss from 6 months to 10 years. And the penetrating keratoplasty is the dotted line. So you can see that the patterns of cell loss differ fundamentally over time. After penetrating keratoplasty, the grafts undergo a very rapid cell loss, reaching 70% cell loss at 5 years. After that, the rate of cell loss seems to stabilize, and they only reach a cumulative cell loss of 76% at 10 years. Now with DISSEC, we had a little more perioperative cell loss, so we're starting out a little lower at 6 months, but then we're having a much slower rate of cell loss over time. But by 10 years, we've reached 71%. So what this is telling us is that we really need to follow these DISSEC grafts for longer to see whether they will also stabilize at a low cell count the way the penetrating keratoplasty grafts do. Because at 10 years, our DISSEC grafts still have a higher median cell count than the penetrating keratoplasty grafts in the cornea donor study did at 5 years. So we may not have reached stabilization yet. So the strengths of this study are that we had a similar sample size, similar patient diagnoses, examination windows, and we used the same statistical models as in the cornea donor study. But the limitations are that clearly this was a retrospective study, a single center, 6 surgeons, and the cornea donor study was a more rigorous multi-center, multi-center 68 surgeon study. And they used a central corneal reading center. Now there is a study planned that's underway in the United States, the Corneal Preservation Time Study. They've already enrolled 1,300 patients, and they're following them out to 3 years. They hope to extend that further. And so this is going to provide additional information about how DISSEC compares over time with penetrating keratoplasty. So in conclusion, the 10-year graft survival for a DISSEC looks good. It looks like we don't have to really worry about that as a concern. Also, the cumulative 10-year endothelial cell loss appears to be pretty similar for DISSEC and penetrating keratoplasty. But we do need longer follow-up out to 15 and 20 years to see what happens with the endothelial cell counts over time, whether they stabilize at a low level as they do after penetrating keratoplasty. We found that the 10-year cell counts were correlated with the 6-month endothelial cell density, so we want to minimize perioperative cell loss with improved techniques. And prior glaucoma surgery is the most significant risk factor for graft failure, as we've heard in multiple talks at this meeting. Grazie.